Welcome to the Happy Doc, the voice of fulfilled physicians. This show is about bringing inspirational, creative, successful, and happy health professionals to you. Get ready to learn how you can be a happy doctor too. Hello, everyone. This is your host, Dr. Taylor Brana. Before we begin, I just wanted to say that I've been extremely busy doing some really amazing projects that I'm very excited to reveal in the future. And to all my listeners, I think if there's something that I've learned with the Happy Doc, it's that not only do we learn from our great guests, but we need to be inspired by our guests. And every single guest I've had on has been a true inspiration to me and all of the listeners that have had the absolute privilege of being able to listen to this podcast. And through that, I've personally transformed and been really excited about innovative projects, about not being burnt out anymore, but building the future of healthcare. So I'm really excited to be building and creating projects which I think will provide solutions to our healthcare and burnout epidemic that we're facing. And it's with that same concept and in that vein that I want to introduce our next guest, and that's Dr. Leah Houston. And she has a community she's building called HPEC.io. That's HPEC.io. And I truly mean this when I say it. This technology could really change the climate of healthcare. But it can only do that if we understand it and we can adopt it. So let me first start off by saying that her technology is something in the realm of blockchain technology. And for those who aren't familiar, a blockchain is called a distributed ledger technology. And what that essentially means is that there is some amount, commodity, or information, and that information is spread within a network of computers that protect that data. And instead of there being like a third party, let's say a human or a bank or some other third party verifier, the technology itself, through the computer system, it's verified through multiple points and it protects that data. And it's not run by people. It's run by computers and algorithms that make sure that the data is correct and that it can be verified from multiple points of view. So it's actually more safe. There's no way to really corrupt it, because if you corrupt data from, let's say, one computer, the other systems from multiple locations would protect that data. So it's a very safe way of protecting information without third-party interference. And now Dr. Leah Houston, and in this conversation we're going to talk about it, wants to put forward the idea of this technology that will protect physician identities. And one implication just off the bat is that credentialing for physicians takes 3 to 4 months, but this technology would make it instant. Full disclaimer, I want to be a part of the mission. I want to join the community, and I am in full support because I think that it's technologies like this that will allow us to rehumanize healthcare by letting the robotic work, such as this identification process, be done by systems that can do it much faster, much safer, and allow us to do the human work, such as helping our patients. So without further ado, let's listen to Dr. Leah Houston. Hello, everyone, and welcome to another episode of the Happy Doc. I'm really excited for our next guest. This is Dr. Leah Houston. Leah, thank you so much for being with us today.
Thank you.
Well, again, it's awesome to have you. And we're going to be having an amazing conversation about a project that she is starting. It's really amazing. Before we get to that, though, I would like to start off by asking you, what got you interested in medicine?
I got interested in medicine because I had an aptitude for science, and I looked at all the jobs that you could do, and I said, I'm a people person, though. And so I thought about, becoming a nurse. I thought about becoming a physician's assistant, and my physics teacher told me, oh, well, you have an aptitude for this. I think that you should become a doctor. And I said, oh, wow. I love the profession of medicine. And it's always been my passion since then.
Amazing. Amazing. And did you have like an early experience or something that kind of sparked your interest? Did you have a physician that, you rotated with or shadowed that kind of gave you some inspiration? Was there anything like that? Or did you just kind of have that interest and you went for it?
Well, I mean, I was more inspired in my younger years. My father had epilepsy, and so I saw him have seizures. I also was exposed to the emergency department a lot because we were uninsured at times. So I experienced a lot of those things. That's what got me into emergency medicine. My mentor, Dr. John Burton, is somebody that I've always looked up to. He mentored me through medical school and residency, and he and I still stay in touch, which is nice. I have lots of other mentors also.
Amazing. Amazing. And, it's something we find often is there's like a personal story or touch in there that gets us kind of excited. Emergency medicine is definitely an exciting field. Was there anything specific? You had like some of that personal story in there. Was there something specific that drew you specifically to emergency medicine, or was it kind of something you fell into as you were going on rotations?
Well, again, with my childhood not having insurance, that was where I got my medical care. And also my father having had seizures, we were in the emergency department with seizures sometimes. So that was what I understood medicine to be. I volunteered there, in undergrad and loved it even more and continued on. So
amazing.
Yeah.
So now let's develop this story a little bit. So you went through the process, you became an emergency medicine physician. And I know that, your project, and we're going to talk about HPEC, as you develop this project and this vision, you dealt with a situation in your story that kind of had this come up. So can you explain that to the listeners?
Yeah. So, I went through all the schooling we all did, and I got my first job as an attending, and I was being pressured to do the wrong thing. And so after that my first employed job, 3 months later, I had quit and I started working locums. And I said, well, if I'm an independent contractor, I'm working independently, I have more control over, my right to work. And that was true somewhat for the most part, but I was bouncing around from hospital to hospital a lot, credentialing for lots of different hospitals. And I moved from Florida to California and worked there. And then I took a job back in Florida. I realized that my Florida medical license had lapsed, so I reinstated it with no problem, started working in Florida. And the director came to me about a month after I started working and said, Leah, we have a problem. And I said, what happened? And I got a letter from the Center for Medicare and Medicaid saying that my privileges to bill for Medicare and Medicaid were revoked. I was terrified. I said, what did I do wrong? I've never had a lawsuit. And it takes 40 days of bureaucratic paperwork and phone calls and overnighting letters for me to essentially find out. Actually, it took more than 40 days, but they thought I was working without a license. I said, that's not true. I've never worked without a license. Months later, I find out that a hospital was using my Medicare Medicaid PTAN number to bill for charts on patients I had never seen in a hospital I stopped working for. And this was a security breach of my identity.
Wow.
And, when we do this, we're faxing all these kinds of documents, we're overnighting things, we're signing away our passwords. It's very, very insecure. And I never even thought that this could happen to me. Fast forward, I'm also an investor, and I was investing in cryptocurrency, and I was reading every single white paper, investment strategy paper on blockchain technology. And as I'm reading, I said, wow, this could be a solution. The distributed ledger technology could be a solution for the digital identity problem, not only for doctors, but for patients, for hospital systems. The 2 to 3 months it normally takes to credential for hospitals could be shortened to moments, if not, seconds, and could cost way less than the $7,000 to $11,000 that it costs for hospitals. So it would not only provide a solution for doctors, but it would provide a solution for hospitals as well.
Amazing. And so I kind of wanted, for my listeners who aren't, at the attending status just yet. So when you become an attending, just to summarize, you get this identification code per se, right? That
The NPI.
basically that your NPI, right?
Okay.
And it allows you to prescribe, and it's your identity. And your identity was essentially breached, and you ended up in this kind of scenario where someone was using your identity without you knowing. And then the credentialing process itself, and you kind of enlightened me on this because I'm not there yet, is that as you start to get credentialed for a site, it takes months. And now, just to kind of explain it for people who don't know, what does that process look like to actually get credentialed? Why does it take so long right now?
So it's because the system is extremely antiquated. It's despite all these advancements in technology, the hospital systems use the snail mail approach. They overnight a packet to you. You have to send copies of every single, license or certificate. Then they have somebody make a phone call, make sure that you're actually who you say you are. So this authentication and validation process is very old school for hospital systems. And a lot of it is because they don't feel comfortable trusting any other resource. Because if you have something uploaded onto a website, there's no way to guarantee that what they see today is exactly what's going on today, meaning have you been sued? Have you had your license revoked? So the only way to be certain is to have it, all done. And so, this is one of the many problems that we face that's leading to, there's this extreme administrative burden placed on doctors and hospitals because of all the bureaucracy that's involved.
Right, because they're trying to prove, I heard that they're trying to prove where you went to college, where you went to medical school. Right. They're trying to figure out this entire history about you. There's a lot of paperwork going back and forth.
And they also call every single hospital you've ever worked for and make sure that you left in good standing. Make sure you didn't kill a bunch of people. Make sure you weren't hated by everybody. Make sure you actually, are who you say you are,
Yeah. So now let's kind of go to the technology side now. We have, and I know a lot of people aren't very familiar with blockchain, but essentially this is a encrypted data source that's well protected, that could protect this information, correct? And the data would be transmitted instantly. So like you said, it could happen in moments. For the people who aren't as familiar, I know it's very technical, but is there a way you could kind of explain how that works?
Sure. So everybody had their medical degree, excuse me, and their residency certificate. You do that once. You don't need to do that again. There's no reason to authenticate and validate that a second time ever in your life. Even if you lose your medical license, you still have your medical degree. So what I'm proposing is that we have a digital space where you store that information. And then you can also store your licenses and attach them to the dates that they go on to. And if this is stored in a digital space with a keyed entry mechanism, where you as a physician can do either a two-step authentication process, fingerprint with a passcode, or facial recognition, which a lot of us use that already with our iPhones, then you can allow permissioned access to that. So this allows permissioned access to the hospital. So if you're working for a hospital system, they can then validate that your credentials are valid. They can bill for your care to Medicare, Medicaid, or insurance companies. Insurance companies could also use this. And then the instant that you as a doctor don't want that system to have that information, you remove that permissioned access, and they no longer can use it. And so this gives doctors an opportunity to have a self-sovereign digital identity that's attached to their credentials. And self-sovereign means you're in control of it. You decide whether it's being exposed, whether it's not being exposed, whether you want to be shown as available for work or not available, and things of that nature.
Yeah, and as I'm listening to this, it's extremely exciting to me because it really is wins all around, right? It's a win for the physician. You say that the data is protected. You're winning in terms of time, right? Because let's say you're doing locums work, for example, that'd be huge
no more
bonus.
Paperwork.
Oh my gosh. And now I'm thinking like for locums work, I'm sure you're planning in advance. If you're working 2 months here, 1 month here, you have to do this credentialing well in advance. Whereas now the data is protected. You can have the transfer of data pretty instantly. It's safe, and it's encrypted. And so the thing about blockchain, for people who don't understand, is there's no third party. There's no one that's regulating it. It's all protected. It's a multi-computer system that protects the data.
Right.
And so it's very safe. And now on the hospital side, from my understanding, this would be a huge money saver and time saver.
Yes. Yes, and it's not just for the hospital side. So if you're a direct primary care and independent physician and you want to seamlessly transfer your skills or validate you are who you say you are, this is a way for you to do telemedicine. This is a way for you to offer your services as a consult. If, there's a super, super duper specialist who's seen hundreds of a rare case of a disease in Oklahoma City, Oklahoma, and there's a patient with that same disease in New York City and they want to consult with them, it's also a way for physicians to discuss patient care amongst each other in a easy, quick, validated, authenticated way. The person is who they say they are. So it's not just for hospitals. I think that it's the best use case because most physicians are employed by hospital systems or by non-physician groups. So, there's lots of use cases. The hospital system is one of the best ones, but there's many, many more.
Amazing. I think the implications might be even beyond what we're talking about right
Absolutely.
now, for sure. So
I have hundreds of use cases. Yeah.
It's beautiful. And so I know you've had conversations, with more people than just me. What are some of the concerns or questions that come up when it comes to technology, and what have been your responses to that?
So questions from physicians, blockchain technology is kind of on the edge of reality because it's something that's never been done before. But similarly to how we talked about the internet back in the 90s, and a lot of people didn't even have internet in their home. They heard the word email. They said, what do we need that for? I don't get it. And now it's all that we use all day, every day. Without the internet, nothing happens. Commerce would cease. So in a similar way, blockchain technology is now being talked about. People don't really understand its applications, but 10 to 20 years from now, I would assume that on a day-to-day basis, you would be having multiple interactions with blockchain and distributed ledger technology interfaces in order to make sure that your life is secure, your digital identity is secure. Things are already happening at a very rapid rate. The singularity is coming. And so this is something that's going to need to kind of follow suit, and it's going to give us the tools to allow it to continue to accelerate.
That's amazing. And I think, we're going to kind of move this conversation in terms of how we're going to promote this project, of course. I think it's really important, especially for people who are interested in innovation, to be really curious about your project, because I think this is something that's extremely important. Like we talked about, it's going to have a lot of implications. So in terms of support, this thing is still early. We're still getting it up off the ground, and you're developing, right? How far are we into the development of this project, and how can people jump on and support at the time of this conversation? I know we're going to post it a little bit later, and I know it's going to be developing, but what are some things that people can look forward to, and how can they help?
So essentially, I have the technical team. I have multiple technical advisors, Yobi Benjamin, Bernard Lee. I have healthcare blockchain advisors, Alex Kahana, Team Block Society, Yasmin Drummond, Travis Wallace, all these people behind me. And I have been offered investor money to build this out. And if I took that $1 million and gave the VC investor 10%, then I would already have this running. But it's very important to me that this stay physician owned, as physician owned as possible. So I'm really trying to build the community of doctors first. And something to recognize about this blockchain economy, it's about decentralization, taking power away from the people that don't deserve it, that are not providing any service to doctors or to patients, systems like hospitals, systems like insurance companies, and redistributing it in a decentralized way, meaning to the individuals, to the doctors that are actually providing the care. And the future of commerce in this new system, in this new way of thinking, is going to be built on community-centric approaches. It's going to be built on tribes of people who work towards a common goal and who share a common effort. And so we're building the tribe of physicians that are going to be delivering care, that are delivering care now, but they're going to be delivering it in the future, free from third-party interference because of this technology.
Yeah, that's amazing. And, one of the biggest complaints or issues or frustrations that we hear from a lot of physicians is now lack of autonomy. Yeah. And lack of a sense of freedom and control. Now, we've had conversations about there's different stages of medicine, like health 1.0. If you've kind of heard the concept, 1.0 is when the physician owned the practice. It was very paternalistic. The doctor did their art of medicine. It wasn't evidence-based per se completely. Right. And now we've gone to evidence-based medicine, but it can be very structured. And obviously we still want to be evidence-based. But then It's so structured, we don't have that sense of control. And now you're offering a solution where we can really take things back into our hands, that we have a control of our identity, but even more so, it sounds like it's almost political in nature. So can you kind of speak to that?
It is political in nature. The paternalistic model didn't work. It worked for many, many years, but once advancements in science, once evidence-based medicine became mainstream, it wasn't working any longer because patients were able to Google things and understand things. And a lot of times the physician didn't even know in depth about a lot of things because the information age is upon us. And so we're moving from that paternalistic way of practicing medicine into a more collaborative, doctor-patient relationship, discuss the plan, come to an agreement together type of solution with the guiding hand of a physician who still is very has a in-depth understanding and knowledge, but also acknowledges that, patients have choice. And I argue that physicians have always been the protector of patients' rights and patients' data. And in this, oncoming age of data and digital health, I think that the physicians still do need to make sure that they protect their patients in that sense and make sure that they're not being unfairly influenced by outside third-party interferers even outside of the doctor-patient relationship, and that will help that as well. This digital identity will have attached to it an ability to vote on confidential consensus. So physicians can discuss policy, discuss practice, and make decisions on whether or not things should be implemented or not. New procedures, new guidelines, new technology that comes out that claims to be good for the patients. Well, let's look at it objectively, free from third-party interference, and let's, as the physicians, come to a collaborative consensus and then publish that data so that patients are informed not by systems that are for profit only, but by systems that have the best interests of the patients at heart, which is the doctor community, I would argue.
Yeah, I mean, technology is moving at such a pace and in a way that we're becoming very connected. And I'm curious to see the implications, such as this technology, some of that voting power you're talking about, and other technologies coming out there. See kind of what the landscape looks like really soon. It's going to be interesting also to see how people adopt this concept. But I know people listening to this will be very excited. And I want everyone listening to really think about this concept. I think it's very important. And whether you're a student, a resident, or a doctor, I think this is a project we need to be thinking about. Because again, autonomy has to be probably the number one thing I hear about in terms of this podcast. Happiness, having a sense of freedom and control is extremely important. And I want people to take this project seriously. Now, to move a little bit, I'm just curious, in terms of innovation, are you seeing anything else down the pipeline, other projects or things that you're excited about?
In regards to blockchain technology?
Blockchain or anything else that you've kind of looked at or are interested in? Just out of curiosity.
There's so many awesome things out there. There's a lot of AI applications to the digital health space to understand, prediction models for, readmission rates and things like that. I think that we just need to be very careful because data can also be manipulated, just like statistics can be manipulated and misrepresented in studies. And this is part of why you want the objective physician voice to be reviewing these things, as we already are, but we're doing them in a siloed way, doing the best we can. A technology like this will allow us to convene over those types of issues. I'm obviously a big blockchain buff. I like to, learn about but this is the only physician-owned, physician-run, sovereign digital identity physician program for physicians where there's a governance attached to it also. There are some other protocols that are trying to do both, trying to get the patients and the doctors to sign up. And, these are potential platforms that could be partners. We could work with them in the future, but without the collective physician voice, it's free from influence of these entities or other entities. Then how are we to determine how to interact? How are we to determine the rules of engagement? It would be very difficult to do that by ourselves ongoing.
Yeah, so this is a really great way to get everyone on the same page, essentially, and then you have that decision-making ability. Yeah, that makes a lot of sense. And so for people who are very interested and want to look into this further, what is a way they can contact you or check out for more information?
So the website is currently HPEC. That's www.hpec.io. And it stands for Humanitarian Physician Empowerment Community, and also Empowerment Coin, because if we do decide to use a tokenized incentive-based economy around this, then we have the potential to do an ICO if we choose to, or we can use the current cryptocurrencies that are out there. And this is, I want to just briefly touch on that. I'm seeking initially 1,000 founding partners because I want to have the collective physician voice helping to build this technology. I've thought a lot about this. I've talked to my current founding partners already, and we've talked through a lot of the ways that we would want to have this built. And I've spoken to my technical leads, and they say a lot of it is possible. But I want to make sure that the physician voice has a say in this. So the best way to do that is go onto the website, hpec.io, apply to become a founding partner or a member. And I'm not asking for any money. So this is just a pledge to say, this is something that seems important enough for me to put my name down as somebody that if this is built, I would potentially want to join. It's not a promise. It's just to show the world that we as the physicians are ready to stand up and take our spot at the head of the healthcare decision-making table, which is where we belong. But, if we don't do that collaboratively together, that would be, it would continue to be more of the same exploitative process as this current system is imposing upon us.
Yeah. That's really powerful. So yeah, everyone, again, it's hpec.io. And if you're watching this on video, you can actually see the website on here. And that's really exciting. So I want to wrap up with some questions that I ask people kind of more on a positive note. Can you think of a time that was really fulfilling or a moment that you had with someone while you were an emergency medicine physician that was kind of striking for you? Does anything come to mind?
Oh my God, so many. I mean, I get to see, the edge of humanity there in the emergency department. And I've left to do a private practice in precision medicine because this system is so broken. But I have to say it breaks my heart because I love what I do in the emergency department. I get to take care of the old, the young, the rich, the poor. And one story that I remember very vividly was actually last summer. I was working in a very socioeconomically disadvantaged part of New York City. And then I also was working in a hospital that was out in the Hamptons, and very wealthy people. And in a matter of 2 or 3 days, I was working at both hospitals at the same time as a locums doctor. I had 8-year-old boys that came in. One had an acute appendicitis, and we did not have pediatric surgery at that hospital, so I needed to transfer him. And the other had tried to commit suicide and slit his throat with a knife. And so both had parents at the bedside. Both mothers and fathers were very worried, wanted the best thing for their children. And the child with appendicitis, their parents heard that he had appendicitis and that we would be transferring him to the closest children's hospital. And they said, absolutely not. And they called their private helicopter. And the private helicopter came and picked him up and brought him to a big university center in New York City. And he was able to immediately get the care he needed. I spoke to the pediatric physician who accepted him immediately. I spoke to their private concierge doctor on the phone. And, I compared that to the experience that I had with the child in, this really, economically disadvantaged hospital that I worked in with no resources, no pediatric psychiatrist on board. And that child sat in the emergency department for 72 hours, waiting for a psychiatric consultation. And in my opinion, despite my greatest efforts, I actually called friends who were psychiatrists to see if they would take his case pro bono. He left with no follow-up appointment with a child psychiatrist. And I gave the family my personal phone number. But in both instances, the parents wanted the best for their children. And, the resources, and these hospitals are only a couple hours away from each other. The resources at the different hospitals, and because of, the economic situation of the parents was so different. And it broke my heart every time I experienced that. But I also was very grateful to be able to do something, and to do the best thing that I could in both instances. And it's those moments that I think I'm going to miss the most when I'm working in private practice, because I'm going to be less likely to see those types of dynamics and things like that.
Yeah. And you got to see two worlds. I mean, and right next to each other kind of. And I think it's amazing that in both instances, you still found some good in it. And you're able to see that you're still able to help. It's very sad that child cannot get follow-up care. That's very frustrating as well. And we definitely.
I actually did. I called them up a few weeks later, and they did end up getting into a city center, but it was very stressful and very difficult for them. And child psychiatrists are hard to come by, and a lot of this has to do with this physician shortage issue is something that this technology would also alleviate. If, physicians have autonomy in how they practice medicine, they're happier, they're more likely to stay in jobs, they're less likely to go into private practice in that suburban community where it's going to be easier for them. We're all trying to do the best we can, and we need to allow physicians to have rights again, to practice medicine the way we were trained. We all took the oath of Maimonides, or the Hippocratic Oath, or the Oath of Geneva, and we all still, feel that way. We all still want to do the wrong thing, and the system is preventing us from being able to do that. So we need to take a stand and come together collectively. And this is free from party. This is free from practice. This is your own sovereign identity. This is you. This is owned by you. It's your professional brand, but it allows you to connect with the tribe of physicians that are caring for the world. I'm hoping that this becomes global eventually, but it's just in the U.S. now.
And it definitely could be. And I'm, a lot of people are scared about medicine. I'm actually really excited because I think, and you're nodding too. I think we're in agreement that there's the technology coming out is actually game changing and could have a huge impact, but it'll only work if people are listening to this conversation and staying informed about the opportunities that our tech and innovation and people like you who are really taking charge
staying informed in that process, because there's some big changes that can happen, but it only happens when we all kind of buy into it. I think it's really important. I just
want to bring up, Practicing Physicians of America is doing a class action lawsuit, to combat the maintenance and certification requirements that are really laborious, not necessary. And there are some physicians I've spoken to who have decided to just on their own not participate anymore. And they lose their patients. The insurance company won't send them patients any longer. They have major problems with their practice, and they're essentially forced to do this, these certifications that cost money, cost time, don't serve them, don't serve our patients. I'm renewing one of my licenses now, and I'm doing these tests and spending my time. None of it is new information. I'm spending lots of money to get it done. But the reason this is happening to us as physicians is because we're not in one place. If we all were in one place, we could collectively decide, you know what, this isn't okay with us. We're not going to participate. We'll always take care of patients. This isn't going to be an antitrust violation, but we're going to stop the human rights violations and the civil rights violations that we've been experiencing. And that's what this is about. But if we don't all get into one space, it can't happen.
I love it. And I think anyone listening to this conversation should be fired up. I'm definitely fired up. And I want everyone to check out Leah's website and the organization and be a part of the mission. I know I'm definitely going to be a part of this mission as well. Full disclosure, with disclaimer, I'm excited about this. So I think it's something to be a part of. And again, the website's www.hpec.io. I usually finish off with like a tip from our guest today. Is there anything that comes to mind?
Don't lose your fire. Don't lose that seed that was planted in you when you decided you wanted to be a doctor. Don't forget who that person is. We've all been disempowered. We've all been stressed out. The system is rigged against us, but we are much more powerful than that system. And our patients trust us. And that's something to never forget. And that's what we're banking on, that they're going to continue to trust us. And that in order for them to continue to trust us, we need to be free from third-party interference in the doctor-patient relationship. That needs to go away. And this is, I think, the way to do it.
Amazing. Well, thank you so much for your time. I really appreciate it. I think we really got into the basics of your project and some of the implications. And I think people should be excited and should look further by checking out the website again. And that was great. Thank you so much.
Thank you for having me. Thank you for listening. Yeah.
All right. And take care.
You too.
Thank you so much for listening to the Happy Doc podcast, the voice of fulfilled physicians. If you enjoyed the episode, please drop us a like, comment, and share. Share us through the social media channels we have on Facebook, Twitter, and Instagram. The handle is @HappyDocPodcast. That's @HappyDocPodcast. You can find our website at www.thehappydoc.com. Again, thank you so much for listening to the Happy Doc, the voice of fulfilled physicians.